Thank you for joining today's webinar, Medi-Cal Expansion and Health for All Kids, Tools and Resources for Communities. Today is April 20th, 2016. To kick off the webinar, I'll introduce Mayra Alvarez, President and CEO of the Children's Partnership, to give a brief introduction and overview of today's webinar. Mayra?
Thank you, Fatima. Hello, everyone, and welcome. I'm Mayra Alvarez, President of the Children's Partnership, and I'd like to welcome you all here today. We had over 760 people register for this webinar, which shows the incredible statewide interest in the new reality of health coverage for all California children. If you know someone who is interested in today's presentation but was unable to make it, this webinar is being recorded and will be available at healthforallkids.org, where a multitude of other resources about Health for All Kids is available. Today's webinar is being presented to you by a strong coalition of advocacy organizations representing a broad and diverse array of perspectives and expertise, including Asian Americans Advancing Justice, Los Angeles, California Coverage and Health Initiatives, the California Endowment, California Immigrant Policy Center, Children Now, Children's Defense Fund, California, the Children's Partnership, Community Health Council, Health Access, National Health Law Program, National Immigration Law Center, PICO, California, United Ways of California, and Western Center on Law and Poverty. Thank you for your work to make today possible. We would also like to give special thanks to our incredible philanthropic partners in California. In addition to the California Endowment, the David and Lucille Packard Foundation, Blue Shield of California Foundation, Kaiser Permanente California Community Benefit Program, and the California Healthcare Foundation, amongst many others that have been critical to this historic policy change, supporting efforts to ensure all children are covered for many, many years. And finally, I'd like to thank all of you, our community partners from across the state, for joining us today and for being the real driving force that will make Health for All not just a policy change, but a true reality for thousands of families. It is because of our collective efforts that hundreds of thousands of children will have access to Medi-Cal and the security that comes with having health insurance. In doing so, California will become the state with the largest immigrant population to provide health care coverage to low-income, undocumented children. Many of our most vulnerable families will have the peace of mind knowing their children are covered if an illness strikes or a serious accident happens. And millions of Californians have a bit more renewed hope that the job of accomplishing true health for all is possible. California is stronger when everyone has access to health care, and together we can keep the momentum going to cover every member of our family. So let's get the official presentation started. Just a few housekeeping notes to remind you. Due to the high number of participants, we will only be able to accept questions via the webinar chat function and not over the phone. But you can also email us at questions@healthforallkids.org. And finally, I must make the disclaimer that this webinar is off the record and not intended for press purposes. If there are press inquiries, we encourage you to please follow up with us offline. The timing of this webinar couldn't be better since we are 25 days away from the expansion going live. Today's webinar is intended to serve as a resource for community organizations in assisting families impacted by the recent Medi-Cal expansion for undocumented children. The objectives of this webinar are threefold: to educate, enlist, and engage. Educate stakeholders about the details of the Health for All Medi-Cal Kids expansion. Enlist help to share information so that implementation is as successful as possible. Engage in dialogue with communities to identify and address emerging issues and share resources. Today we will start out by describing the new website, healthforallkids.org, and the free toolkit available for community-based organizations, and we'll review the basics of Health for All Kids. We will also have presentations from experts in the state about what you really need to know about the expansion. We will then hear from some community leaders about the local opportunities, challenges, and lessons learned. And finally, we hope to spark discussion during a question and answer segment where even more experts will join us to to answer some of your questions. Since we may not be able to answer all questions in our time today, we are planning to host a Health for All Kids Town Hall Forum on May 6th, with more details to come. So, to get us started today, I'll hand it back over to my colleague, Fatima Morales from Children Now. Fatima?
Thank you, Myra, and everyone who is with us today. My name is Fatima Morales, and I'm a Policy and Outreach Associate with Children Now. I'll be moderating today's webinar. We've got a lot of great speakers and a lot to cover, so let's jump right in. So we're together today to share and unveil a new toolkit that all the organizations on today's webinar have put together to support your local efforts to ensure health for all kids in your community. Because in the end, we're all in this effort together, and this state law will only have its intended impact if local communities are able to connect with families who are newly eligible for this coverage. The Health for All Kids Toolkit is a free bilingual online toolkit that you can access at healthforallkids.org. It includes lots of helpful information, detailed information that includes resources about the Medi-Cal expansion for all kids regardless of immigration status. Key components of the toolkit include basic info and frequently asked questions on things like premiums for coverage, enrollment tips and information, free outreach materials, messaging tools your organization can use to support outreach to a variety of audiences, a checklist to support local implementation, and much more, like information on your local Healthy Kids program and the transition to full-scope Medi-Cal coverage for all children. As Myra mentioned, we have experts from all across the state joining us today who will provide more detailed information about Health for All Kids. But before we jump in, let's start by reviewing some of the key facts about Health for All Kids. Health for All Kids is what we're referring to as Senate Bill 75 and Senate Bill 4, which passed last year, that expanded full-scope Medi-Cal coverage to all kids regardless of immigration status. As a result of this new law, all income-eligible children up to the age of 19 can now enroll in full-scope Medi-Cal coverage, which means that includes vision, dental, mental health services, the full benefit package that kids can take advantage of to ensure their adequate health. Children with restricted scope Medi-Cal will transfer to full scope Medi-Cal without having to reapply, and this is extremely important point to stress because it means that families who are excited about this new opportunity for full scope coverage should make sure that their children are enrolled in restricted scope Medi-Cal to ensure that their children are automatically transferred into full scope Medi-Cal and that they can take advantage of the benefits as soon as they become available. Children with county-based coverage or Kaiser must apply for Medi-Cal unless the child is already known to the Medi-Cal system. The same rules for children who are newly eligible for this full-scope Medi-Cal coverage, regardless of immigration status, will apply as if for other Medi-Cal populations, which means these children will have the choice of enrolling in a health plan, premiums, and the same rules as it relate to the California Children's Services Program will apply to this population as well. So a few key dates to keep in mind about the Medi-Cal expansion for all kids is, according to Senate Bill 75, the program should start no sooner than May 1st of 2016. May 16th of 2016 is currently the scheduled start date, so we are very excited about that. That's right around the corner. Families should enroll now to transfer into full scope Medi-Cal when the expansion begins. So as I mentioned earlier, there's a lot that families and community-based organizations can do today to get ready for the full scope Medi-Cal expansion for all children. And one of the key ways to get ready is if your child or if you know families whose children are not enrolled in restricted scope Medi-Cal, families should enroll now to make sure that their children are seamlessly transitioned to full scope Medi-Cal when the expansion begins. Another key point to keep in mind is that retroactive coverage begins on the first day of the month in which the program begins. So for example, if the program goes live on May 16th, as is currently, retroactive coverage will start on May 1st, so the first day of the month of that year. Want to make sure folks get all the information they need, so I'm going to turn it over to our next presenters, Jen Flory, Senior Attorney with the Western Center on Law and Poverty, and Corey Rosella, Staff Attorney with the National Health Law Program, to dive into and give more details about the Medi-Cal expansion for all kids.
Okay, Corey, I'm with the Western Poverty, and Corey Rosella and I are going to talk about some of the basic Medi-Cal eligibility rules, how you apply for Medi-Cal, some of the issues regarding managed care. Okay, so the first is about kind of a level setting on Medi-Cal and immigration status today. What are the rules around immigration status and receiving Medi-Cal? Today, immigration determines the scope of Medi-Cal benefits. So this is a little different than a program like Covered California, for example, where somebody's immigration status determines who is allowed to enroll. In Medi-Cal, everybody can sign up for Medi-Cal, but somebody's immigration status will determine how much that person is able to get. So for people who are undocumented or certain immigrants who have temporary visas, they only get restricted scope benefits. And that means that they can get emergency services, they can get services related to pregnancy, they can get certain limited things like kidney dialysis and long, but it's a limited package of services. Full scope services include all medically necessary services as well as dental services, prescription drug services, mental health services. So it's, pretty much most medical services. So if somebody has what the Medi-Cal program considers to be satisfactory status, that's one of the immigration statuses that they'll provide full scope services to, then you can get full scope services. Now, some people may have heard of the term PRU-Call, and that is a specialized term that the Medi-Cal program uses, permanently residing under color of law. Know about that term if you're working with immigrants who have some rarer statuses that may not be in the short list that people think of who qualifies for full scope Medi-Cal benefits. For example, most people know that people who are lawful permanent residents or are, have eligible for full scope services, but they might not know specialized statuses like deferred action, including the deferred action for childhood arrival, the DACA status, that those people are allowed to get full scope services too. So what is changing is that the children who previously could only get restricted scope can now get full scope as well. So just before we go on to the next part, I want to make sure that people are absolutely clear that anybody can apply for Medi-Cal benefits. People that are eligible for full scope services, like people with deferred status, and they can, have full scope Medi-Cal even with 19. So what should you know about the Health for All Kids Medi-Cal expansion? First, that Medi-Cal doesn't share immigration information, and then as we spoke about before, children should apply for Medi-Cal now, even if they have other coverage or have other family members with coverage. And then the last two things that are some families may have to pay a small premium, and most families will need to select a health plan. Medi-Cal does not share immigration information. There are privacy protections both in state law and in federal guidance, both from the former INS, the USCIS, or Immigration Services, and from our Federal Health and Human Services, which is in charge of the Medicaid federally. So all of these agencies have either guidances or laws that prohibit the of immigration information that's used when applying for and sharing that of immigration enforcement. So it can be a big hurdle to get people over, and the public charge concern where certain immigrants are worried about what might happen if they go to change their immigration status later or they need to adjust their immigration status. Medi-Cal, they can't share that information with the federal government, and Medi-Cal does not from becoming a lawful permanent resident later or from naturalizing and becoming a citizen. So people should sign up for Medi-Cal and know that that's confidential and it's private. Okay, children, as we've mentioned several times, Medi-Cal immediately. And that is because at the time when the Medi-Cal program is able to implement Health for All Kids, there's going to be an automatic rollover of the children who are currently enrolled into restricted scope into the full scope program. So that means that people who are already on Medi-Cal don't need to do anything else. They don't need to submit an application. They will automatically be enrolled into full scope Medi-Cal. Now note that I said that people who are currently enrolled, people who have a renewal coming up in the next few weeks, doing what they need to do to renew. So, so if you're on restricted scope, make sure that you stay on restricted scope, and then you'll be moved in. There are many ways that people can apply for Medi-Cal. If for families in particular that would like some extra assistance because some of the information is complicated, there are application assisters that can help, and enrollment counselors in the community. They can also by phone, by calling their local county office, or they can even call Covered California, in theory, be enrolled in Medi-Cal. They can also, counties, it is practical to go directly to the county office. Some counties also have additional county website, and then coveredcalifornia.com is the application for California and Medi-Cal. Coveredcalifornia.com has a couple stars by it for people who are not documented or would be qualifying for restricted scope now. That's a way to sign up. But we have heard results for some people with some of the different immigration statuses that are not so common, having a little bit of trouble enrolling through coveredcalifornia.com because not some of the questions aren't really geared towards certain populations. In order to apply, things that families should have ready is they need to have they need to be able to say how much they make in a month usually, and then sometimes if their income fluctuates a lot, they need to be able to say how much they think they'll make in the next 12 months. They also need to just have basic information about the other family members, who's in the household, and is anybody else in the family already on Medi-Cal.
And children should apply now for Medi-Cal to get on restricted scope for that the easier transition into the full scope once the SB 75 comes into effect. And this applies even to children that already have another form of local coverage. So, for example, kids who are in the Kaiser Child Health Plan or in another local Healthy Kids program or a county health program like My Health LA. Why these kids need to apply even if they have a local coverage program is that most of these programs, if not all of them, do not keep track of children members have. So it's really crucial to focus on the specific needs of these groups who are going to transition from a local coverage program to Medi-Cal, and to make sure that their options and the procedures are explained clearly. So from one of these coverage programs to full scope Medi-Cal is not automatic, and they must apply. So the families might be getting an confusing and possibly conflicting information from their plans, so it's really helpful to have this very clear in our minds. Because many of these programs do not track whether the kids have restricted Medi-Cal, we need to assess these families whether or not they have restricted scope Medi-Cal now. If yes, they don't need to apply. They will do a transition process. If ways to know if a child has restricted scope Medi-Cal now is to call the county. Department of Healthcare Services mailed out a beneficiary outreach letter on Friday. So all of the children, they think 122,000 children received this letter, and that's an indication that they are known to the state as having restricted scope Medi-Cal. If they don't have restricted scope Medi-Cal, they need to apply now and still keep their local coverage program. One of the key ways to apply is if they have a family member on Medi-Cal already. So I'm going to talk a bit about the Kaiser Child Health Program. And we're going to talk about it because there is a number of children in this program throughout the state. And Kaiser estimates that 90% of the children in there will be eligible for 75, but again, they don't track which ones already have restricted scope Medi-Cal. So child health plan members that don't have restricted scope Medi-Cal now must apply via the standard Medi-Cal application like Medi-Cal. There's a simplified process if the child has a family member on Medi-Cal added to that family member's case. Then the child will have to select Kaiser as their Medi-Cal managed care plan if it's offered as one of the Medi-Cal managed in their state. Kaiser that no child will be from their their plan solely because of delays in the transition to full. And it's important to note in that just having fee-for-service full scope Medi-Cal isn't what Kaiser's looking at, actual plan enrollment. So there should be a seamless transition without a break in managed care coverage for the children who do apply for restricted scope Medi-Cal and get transitioned over. Their similar process, Healthy Kids programs is going to handle it slightly different, to message their members now and encourage them to apply for Medi-Cal because, again, they are not keeping track of who's in restricted scope. And one of the rules about Healthy Kids is that once you're eligible for Medi-Cal, you are no longer eligible for the Healthy Kids. And that's true of Kaiser as well. Once you're on full scope Medi-Cal, they aren't going to use their program funds to provide coverage. You can also partner with your county eligibility division to identify which children are known to Medi-Cal already. I mentioned before, when a child has a family member that is already known to Medi-Cal, has an open Medi-Cal case, the undocumented child does not need to submit a new application. They simply need to contact to get added to that child's case. So maybe they have a lawfully present or citizen sibling who has Medi-Cal and can that person's case. There is a form. It's called MC-371, which is to add family members to a case. This was developed pre-ACA. And counties don't need that specific form. You should just be able to call or go into a county office and ask to be added to the case, and the county should ask you what specific information they need about the child who has to be added. Now, I want to make a quick note about DACA. So, Deferred Action for Childhood Arrivals is an immigration program by executive action, and one of the reasons why someone might want to apply if they haven't already for DACA, and they should consult an immigration expert to see if they're eligible, is that, as Jen mentioned, if you are a DACA recipient, once you age out of the SB 75 program, you might be able to still maintain full scope Medi-Cal once you turn 19. Now, if someone is already a DACA recipient, they can get full scope Medi-Cal today and yesterday and tomorrow. Now, once families are enrolled in Medi-Cal, once they've been approved for full scope Medi-Cal, they should know that it is free for all families, for all children whose income is below 160% of the federal poverty level. For families whose income is between 161 and 266% of the federal poverty level, there is a monthly premium. It's $13 per child with a maximum of $39 per family, no matter how many children are enrolled. Now, that premium also applies if you're above that limit and you have restricted scope Medi-Cal. But note that this is a monthly premium is not the same as a copay. The $13 you pay directly to Medi-Cal, and that's your monthly contribution. A copayment is the amount paid at the time of when services are rendered, such as for doctor's visits or the pharmacy. Medi-Cal does not have copays. So there's no cost for the children when they get any of their Medi-Cal services. So no one should have to pay a copay for doctor's visits, treatments, procedures, or medication. So just to make a distinction, I don't want anyone to be discouraged from applying because they think that they have to pay a $13 copay anytime they go to the doctor. It's a $13 monthly premium, and then for the rest of the month, all the Medi-Cal services are free of charge. One other note, a common misconception about restricted scope Medi-Cal or Medi-Cal above a certain limit is the idea of share cost. Certain categories of Medi-Cal beneficiaries who are above income limits have to pay a portion of their Medi-Cal every month. For children who are above the Medi-Cal limit, this may apply, but again, for children up to 266% of the federal poverty level, only a certain amount of those will have to pay a monthly premium. Share cost is not standard for all children in restricted scope Medi-Cal. Another common fear that people have about Medi-Cal and payment is the idea of a state recovery, which is, you know, you hear people saying, Medi-Cal, if I sign up for Medi-Cal, they're going to go after my home and they're going to take everything from my bank account. That is a program, none of those things are true about the program that does exist, but it only applies to people who access services over 55 years of age. So a state recovery is not a concern for the SB 75 population. If you have any questions about a state recovery or share of costs, please feel free to contact me or Jen Flory, and we can go through your specific concerns, or put them in the chat box and we can discuss them now or at the town hall. Okay, next slide. Once someone has either transitioned into full scope Medi-Cal or has applied and been approved for full scope Medi-Cal through SB 75, they're going to get all of their Medi-Cal services via the Medi-Cal managed healthcare plans. So there are a few exceptions of people who have to enroll, but most SB 75 children will be enrolled in managed care plans. So what is managed care? Managed care is like a health insurance company that will provide all of the services, treatments, medications, and providers. And being in a Medi-Cal managed care plan does not alter or lessen the rights of Medi-Cal beneficiaries or lessen the amount or scope of services that Medi-Cal covers. It's just a method through which people will access services. So NHealth has a series of Medi-Cal managed care papers that you can access if you want to learn more about that. So after someone has either transitioned or been initially approved, they will be put into fee-for-service, and then they will be enrolled into a Medi-Cal managed care plan. So fee-for-service is accepted. So anyone in fee-for-service can, in theory, see any doctor who accepts Medi-Cal. The caveat to this is many doctors who are also in a managed care plan do not accept fee-for-service patients. Another real challenge to accessing care through fee-for-service is finding a doctor. There is a list online, and it has a really complicated URL. So the best way to access that link is on page 2 of the beneficiary letter. FAQ has the link of how to find a fee-for-service provider in your area. So people will be in fee-for-service in the month of transition. And then if you are in a county that has a county-operated health system, or known as a COES county, you will be automatically enrolled to the health plan for that county. So on the slide, you can see the list of the counties that have a COES health plan. So if the transition happens in May, the COES counties will have fee-for-service in May, and then starting in June, all of the SB 75 children will be enrolled in that COES health plan. Now, for all of the other 36 counties, the SB 75 children will have a choice of which Medi-Cal managed care plan to enroll in based on what's available in their county. And these are existing Medi-Cal managed care plans. So what will happen is after the transition, all of the children in these counties will receive what's called a choice packet from Healthcare Options. And it will list the different types of plans in the area, and you can also get a list of providers. These are supposed to go out in the threshold languages of the recipient. And if you need a translated choice packet, you can call Healthcare Options. Once you receive the packet, you have 30 days to select a plan. You can either return the form or call Healthcare Options to select a plan. Or if you don't choose a plan, the Department of Healthcare Services will assign you to a plan based on a formula that already exists. So how do you pick a plan? Well, this is especially important to consider if the child is in a Kaiser or Healthy Kids program. In order to stay with that program, the child has to choose to enroll in that plan. So just because you had a Kaiser Permanente Child Health Plan doesn't mean you're automatically going to get re-enrolled. You have to use the choice packet to choose Kaiser's Medi-Cal Managed Care Plan if it's available in your area. If you're not in one of those plans or you want to switch from one of those plans, you can ask any doctors that the child sees or any clinics that they go to what Medi-Cal managed care plans they take. Also, you can consider if family members are in a managed care plan, does the child want to join that plan? even if someone gets defaulted or they decide they don't like a plan, Medi-Cal beneficiaries have the right to change plans in any month if they need to. No matter what the county or what the county managed care system is, whether it's a coast county or a non-coast county, the plan will mail a welcome packet within a week of enrollment. So one of the major concerns about managed care is a disruption of services that children may have if they have are in treatment or have existing relationship with providers. One way to alleviate that is to ask for expedited plan enrollment. So you call the number at Healthcare Options, which is listed on the slide, and you ask for expedited plan enrollment. It's helpful when you ask for that if you know exactly which plan you want to be enrolled in, so that you can continue services. You want to indicate that there is a medical need or other urgent circumstances that warrant expedited enrollment. Another way to keep relationships with existing providers is to ask for continuity of care. This is a concept that transcends just Medi-Cal, but it does apply to the Medi-Cal managed care population. And the idea is that if you have a relationship, an existing relationship with a provider, your Medi-Cal managed care plan can make an agreement to pay that provider to continue services for up to a year. The Health for All Kids toolkit has a section with links to resources on the Health for All Kids website if you want to learn more about continuity of care. And then the last reason that somebody might be able to work around Medi-Cal managed care enrollment or to keep a relationship with an existing provider is to ask for a medical exemption for managed care. And so this is a medical exemption request that is granted only to people who have certain qualifying conditions and who are in the course of treatment and can't be interrupted from that. I covered a lot of information in a very short period of time, and so I really do invite questions either in the chat box or in the town hall about some of these issues. And again, looking at the toolkit provides a lot of links to resources that can be helpful.
Thank you, Corey and Jen. What a wonderful expert overview, lots of practical information, and just answers to questions that I'm sure on the phone on this call or on this webinar have received. So moving right along, our next speakers are Sonia Vasquez, Chief Program Officer with Community Health Councils, Inc., and Carolina Gamero, Communications Specialist with the California Immigrant Policy Center. They are going to share local perspectives on the challenges, opportunities, and lessons learned regarding Health for All Kids implementation and outreach in communities across the state. Sonia?
So thank you, Fatima, and thank you everyone for being on the call today. So in 2016, Community Health Councils, through our Covering Kids and Families Coalition, our statewide coalition, has been conducting regional meetings and having conversations with all of our partners, really connecting with local enrollers to provide them with updates specifically on SB 75, but also to hear the barriers that they're facing and any concerns that they would have. And, you know, we've done 2 regional meetings already. We have 1 coming up. And I don't think any of this is going to be new for most people. I think every time we have a transition, these are the same concerns, the same fears that we've had. And we're putting out in the universe that this one will be different and things will go smoothly. But what we're hearing from people is, you know, in terms of resources needed, you know, they really need outreach materials. And that's why this webinar is so great. The toolkit is amazing, because it really sort of pulls it together and explains it to people. Whether you're working on and whether you traditionally do enrollment or not, this is really helpful. You know, making sure that we have media communications, you know, the various ways that people will get connected, whether it's, you know, on the ground, organizations, you know, spreading the word, and in conjunction, the various other ways that people get connected, media, traditional media, social media. We need to hopefully invest in some of that, and I know there are some foundations that are doing that now. Training, again, you know, something like this is great, you know, but not just for enrollers. Clearly, everybody else that'll work with this population, specifically Medi-Cal County workers. And there, the barriers that are expected are, what we tend to fear, misinformation, that, people will get mixed messages depending on where they are, who they speak to, and that from county to county the messages just might be different. Technology issues, we've been down this road before where we hope that everything goes smoothly, and then again we're going to put out in the universe that it will, but there are concerns that there will be system glitches which could possibly delay everything. But of course, in order for us to really move forward, we need to make sure that we're working together, across enrollers, county officials, state officials, health plans, organizations that don't typically do enrollment but touch this population. We need to make sure that there's trainings and resources out there, so to the extent that this is out there, but also to the extent that you or other organizations in your community sort of support enrollers, making sure that those local trainings are happening, and that we're really getting the word out, not just after the implementation starts, but now that we're talking to people about enrolling into restricted Medi-Cal and what to expect. So as we think about how communities can really use the information that you've gotten today, we feel like after looking at the list of who's registered, I feel like we're speaking to the choir a little bit, but just to make sure that we're all on the same page, community-based organizations, clinics, we're all crucial to ensuring that families are enrolled into Medi-Cal. So of course, assisting families with navigating the transition and enrollment process. And, and also, whether your organization does this or not, making sure that they're connected to an organization that does, that, you're providing them troubleshooting support. So, if at any point they have trouble accessing the system or utilizing their services, that we're helping them get through all that. We're assisting families through the Medi-Cal managed care process that's been explained already. This might be very different for families if they were in restricted Medi-Cal or if they were in another program. So really making sure that they understand what to expect, who to connect with if they're having a problem, and how to help them choose a new or keep an existing provider, especially if they already have a child that's in Medi-Cal and they want to connect them to the same plan. Preparing them for the premium process if necessary, making sure that they understand all of the ways that they can get discounts and the various ways that they can pay, and the redetermination process. Again, this is going to be different for many families, even if they were already in a health coverage program. And unfortunately, many of them may not be able to go through an ex parte review or immediate review, so they will have to they will have to complete renewal forms and provide income documentation again. So just like we've helped them with income at the application time, we need to be prepared to help them during the renewal time. It's important to share messages and information about Medi-Cal with families, through your flyers, through newsletters, op-eds, word of mouth, other communication, everything and anything that you normally use to get information out. Make sure that we're talking about Medi-Cal, so we're not, we're demystifying it for families and making sure that they know that this is available for them. Coordinating with and partnering with the county. It is our job, it is our role as community-based organizations and clinics to make sure that our families are getting through the process in a seamless way. And so we want to make sure that we're explaining to the county when there are problems so we can alleviate those problems as quickly as possible. And then, of course, as I've sort of mentioned already, we want to make sure that we're partnering together. If you are not an organization that traditionally does enrollment, partner with somebody that does. If you're an organization that does enrollment, but partner with organizations that, may not do enrollment, but also touch the lives of these families so that we can make sure to get as many people enrolled. The goal is to get everybody into restricted Medi-Cal now so we can just transition everybody over, but we'll also want to keep at it, for as long as we can.
And now we'll hear from Carolina with other local perspectives.
All right, thank you so much, everyone. So what I wanted to go over was some of the key messages that would be helpful to use when you're working with immigrant communities. So some of these messages we've taken from our Health for All Coalition messaging document. and I'm sure they're available through the toolkit. And to go over some of those basic messages, I wanted to emphasize that these messages are based in a lot of strong values that resonate with inclusivity, with equality, and with that connection to humanity. So starting off, I wanted to highlight the first one, which says on the PowerPoint, "We're all in this together. California is stronger when everyone is covered." The importance of having a message like this one is that it highlights that this is a group effort. We're not dividing something between us versus them. We're actually building an inclusive vision of health access. So by pointing out that we're all in this together, I think it really forward by making sure that everyone has access to healthcare, and that once everyone does, everyone is stronger and much better off. The second key message I wanted to highlight was that we all have a stake in the fight for health for all. This is especially important for folks to understand when it's, when we're talking about who is benefiting from these advocacy efforts, and it's really all of us. So we all have a stake in making sure that we can all be covered, that everyone has that health access. And then the third key message I wanted to highlight was health is a human right. Everyone should have access to health care no matter where they were born. And from this key message, I think what this really emphasizes is the call to action, and also pointing out the fact that immigration status can also be a barrier, but that through our work and through recognizing that health is a human right, we can break down those barriers. And especially for folks who have been unjustly excluded due to their immigration status, this work is very, very critical. I'd also like to point out that the messaging on the Health for All Kids is made even more powerful when it's broadened and placed in the context of its impact to whole communities. We understand that this is a great step forward for expanding healthcare access for undocumented children, but it's also important to recognize how that impacts immigrant communities and other communities across California. So one thing I wanted to point out was that our inclusive messaging should be broadened to include parents, adults, and families, and this is especially the case for mixed status families. In other words, households that have members of various immigration status. So you may have a child who is undocumented, a parent who is lawful permanent status, or a sibling who has DACA. In cases like this where families are living with different statuses all under one roof, it's important to recognize how the messaging should be able to relate to them, especially when you're working with them. 1 in 5 kids in California actually have an undocumented parent, and this really underlies the importance of using messages that relate to mixed status families. Secondly, the health of parents and adults play a strong role in immigrant communities across California. So it's important to note that by having healthy adults and kids, we actually lead to a stronger California. And then lastly, as I mentioned, that this expansion is a key step towards health for all. We like to make sure that we include this in our messaging as a key step, because there is work to be done to include the adults and parents and family members of undocumented children who will be benefiting from this expansion. So some of the best practices when working with immigrant communities and some considerations that we should hold are to ask patients which language they prefer to use and provide that interpretation and resources in that language when possible. We understand that immigrant communities are very diverse, and when possible, it's very important to provide culturally competent care in the language of their choice. Having resources and also being able to speak with patients in their preferred language will also help put other concerns at ease. Secondly, helping families navigate complex systems of care can be done by helping with the paperwork. Sometimes this process is so complex, just by providing support with paperwork can go a long way to reassure patients and families when they're going through this process. This could also include providing empathetic care by listening very closely to patients in their concerns and also linking them with community resources. There's plenty of other places that provide services for immigrant communities aside from just health services, so having the resources available for them to reach out to is very, very helpful. Furthermore, it's also important to be mindful of the language that you use when identifying or talking with your patients. So it would be really helpful to provide training for staff and remind them to refrain from using terms like illegal or dreamer or DACA kid. And the reason why I go into that is because it can be offsetting for patients who do not relate with those terms. Furthermore, undocumented immigrants have other issues to address in addition to just their status. It is important to respect the intersecting identities of immigrants that include race, sexual orientation, gender, their ability, among other identities. Also, when working with immigrant communities, there may be a lot of concerns, such as fear of deportation. The reality is that immigrant families experience family separation due to deportation. Over several years, we have seen a lot of intense deportations happen under the administration, and many immigrant families are very fearful of seeking services because of concerns that their immigration information may be shared, especially when they're interacting with individuals in positions of power or authority. So it's important to help reduce these fears and clarify that their personal information will not be shared. This is clear through the California Welfare and Institutions Code, section 14100.2, and it clarifies that the personal information that is used on Medi-Cal applications is confidential and can only be used for enrollment purposes and not to be shared for immigration and detention purposes. There is also a covered California immigration fact sheet that will be included in the toolkit that gives an overview of these concerns and also clarifies those privacy concerns. It's also important to note for questions about public charge, sometimes patients are concerned that enrolling in Medi-Cal will hurt their ability to adjust their status or become a citizen in the future. It's important to note that this is not the case, and using Medi-Cal will not allow your child to be considered a public charge. There are certain exceptions, but for public charge purposes, this will not affect their ability to change their status in the future.
Thank you, Sonia and Carolina. So with that, we will now start the Q&A or discussion portion of the webinar. Thank you to all of those who have submitted questions via the chat function. Please continue to submit questions. In addition to all the great speakers you heard from today, we also have a panel of other experts, more experts who are joining us to answer any questions you may have about the Health for All Kids expansion. So the panel of experts that are joining us today are Diana Carlos, who's a program associate with the California Endowment, Mark Deal, executive director with California Coverage and Health Initiatives, Lynn Kersey and Liz Ramirez with Maternal and Child Health Access, Gabrielle Lazard, health policy attorney with the National Immigration Law Center, and Dorina Wong, program director with Asian Americans Advancing Justice, Los Angeles. So because we've had a number of folks submit questions via the chat, I'll just jump right into some of the questions. So first question, how does this expansion affect Medi-Cal eligibility for pregnant women who are undocumented? Liz, can you provide us some of your thoughts on that question?
Yeah, so just to clarify, we're talking about young women under 19. So those women who are in a restricted Medi-Cal aid code for children, they will convert over to full scope Medi-Cal when SB 75 is fully implemented. Women who are over 19, as a side note, who are pregnant and in restricted Medi-Cal, there have been recent changes, so they should be able to get anything they need, just like someone with full scope Medi-Cal.
Another question that's come through, are all Healthy Kids programs ending? Mark, can you help us with that question?
So not all the Healthy Kids programs are ending. Up in the Bay Area, San Francisco's not dropping theirs. but most of them are. It'd be good to talk with your local county to find out exactly what's going on with their Healthy Kids program. But most of them are coming to an end.
Another question, what, in addition to language, are some specific considerations when reaching out to other eligible and often overlooked immigrant populations, such as the Asian and Pacific Islander populations? Dorina, if you could help us with that question.
Sure, and thanks for asking that question. Just as background, Advancing Justice LA is leading some collaboratives in LA and Orange counties to implement SB 75 for the next year. So we've expanded our statewide health to reach, as many undocumented immigrants across the state as we can, and particularly targeting LA and Orange County. In response to the question, I think some of the suggestions and best practices that Sonia and Carolina mentioned are great to reach all immigrant populations. But as Carolina pointed out, the undocumented population is extraordinarily diverse. And so I think a lot of people think, undocumented means Latino, immigrants. But as many of you know, there are just, dozens of other racial groups of undocumented people in the Asian American, Native Hawaiian, Pacific Islander community, in the African immigrant community, the Middle Eastern community. And so, some of the smaller immigrant communities are kind of often ignored and underserved. So they have to be specifically targeted by trusted community messengers that not only speak their respective languages, but also understand the cultural differences and nuances of the specific populations. So one way to do that is to identify community leaders, such as elders or tribal leaders, faith leaders like ministers or shamans to turn to when they have questions. Also, a lot of new immigrants, come from countries that have really different healthcare systems, and so they're really unfamiliar with our complicated healthcare system, especially our managed care system. And it may take a lot of time or more time to explain, to educate them, enroll them, and explain how to pick a plan, how to use their coverage. And other issues, we found, for instance, in the Asian American, Native Hawaiian, Pacific Islander communities, is there's a stigma to enrolling into Medi-Cal. It's a public benefit program. They're unfamiliar with it. So we try to counter those myths and try to point out that, a lot of the programs, even Covered California, and the marketplace is subsidized, or that there's additional benefits for children under Medi-Cal, the EPSDT program, that's more comprehensive than Covered California. So immigrants that have those public charge fears and, the threat that sharing their information can lead to deportation, I don't think that can be downplayed. And so trusted community partners, they must be supported in coordinated efforts, must be used kind of to reach these hard to reach populations. Technical support training key. Just finally, I can't stress enough the importance of in-language, simple understanding materials beyond English and so we're going to be translating S5 materials into additional needed languages, and we'll share them with others on the website in the toolkit.
So the next question, for unaccompanied minors, eligibility based on household income, or is it automatically based solely on being an unaccompanied minor or individual? What about individuals now over 18 who came in as unaccompanied minors? Gabrielle, if you could help us with that question.
For unaccompanied minors, once they've settled with a temporary family or foster care situation, the eligibility is going to be based on the household income. However, there is a program that doesn't have an income requirement. It's only available to immigrants who are in certain statuses. So that's the Unaccompanied Refugee Minor Program, and it actually provides foster care and other services. The statuses that would be most common for unaccompanied minors that are eligible for that program are asylees, people with special immigrant juvenile status, which is granted to young children who have been either abused or abandoned, U visas, which are issued to people who are survivors of serious crimes, or trafficking victims. It's important to keep in mind that very few unaccompanied minors are going to be over the income limit for Children's Medi-Cal. But if they are over that limit, and they have one of those statuses, they could qualify. Since it is a foster care program, or it's considered a foster care program, they're treated the same children in that program are treated the same as youth in foster care. So if they were in the program at the time that they were 18, they're able to continue in Medi-Cal without any income eligibility standards until they turn 26.
Thank you, Gabrielle. So the next question, what media outreach efforts are going on to inform families about Health for All Kids? Diana, are you on the line? Can you help us with that question?
Hello, everyone. So we do have some outreach efforts that we're going to be doing to help spread some more of this helpful information on the implementation process. A few of them are going to be phone banking opportunities. So if you tune in to, there's going to be Spanish language media doing a phone banking on May 3rd as well as, I believe, May 24th. And this is from Univision, Univision. It's called Univision a tu lado, and they'll be providing an open line for volunteers to answer questions, such as the ones that we discussed today on, the timing, any kind of letters that are going to be sent out, and other questions from families regarding enrollment questions. So I can pass that on to Fatima, those details on, for the Spanish language channel opportunities for phone banking. And I'm not sure if others on the line have other opportunities that they flagged that could be helpful for more information.
Hi, and this is Diana. Well, just wanted to start off, we did, in partnership with many of you, the endowment started deploying some of our public service announcements early in December, and we were targeting parents whose children might be eligible, and we started with some public service announcements with Doctora Alisa, and we deployed them in all statewide Univision and Telemundo channels. In addition, in order to outreach to youth, we worked with East Los High to deploy a public service announcement as well as a digital push to let folks, to let under 19 know also that they would be eligible for this expansion. Looking ahead, we are continuing to push our efforts through Spanish radio, Spanish TV, as well as outdoor and in those places that might have hard to reach audience. We are continuing to work with some of our media partners that include Univision, Telemundo, New America Media, Fusion, and one of the things that we are actually doing is we, in partnership with actually many of you, we just launched a 30-minute Total Acceso show dedicated to eligibility, how do you enroll, and any questions that immigrant families might have on the Health for All Kids expansion. That aired on the 14th, and it will air again in the LA market on Telemundo 52 tomorrow. In the 10 o'clock hour. In addition, we deployed some líneas de ayuda that talked about also eligibility and more information on how to enroll, linking them to the California Health Plus hotline number and getting them connected to their local clinic. All this information we will be having in a digital link so that we can continue to use for promotion, and we will be working with all of the partners to make sure that we have it included in the toolkit that is now found on healthforallkids.org.
Thank you, Diana. So the next question, I'm assuming this means for undocumented children, is will kids who are above 266% of the federal poverty level be enrolled in share of cost Medi-Cal? And Corey will respond to that.
Hi, thanks. So anybody above the Medi-Cal income limit who is a child should be considered for share of cost Medi-Cal. Now, someone with income that high would have also a very high share of cost, which would be cost prohibitive. Medi-Cal with share of cost isn't considered minimum essential coverage. I know at least Kaiser's child health plan plans to continue to provide that plan for children whose income is between 267 and 300% of the federal poverty limit, and I think it's up to each of the Healthy Kids programs to decide whether they're going to still offer those services. So technically, yes, they could get a share of cost, but it would be a great barrier to accessing care.
Thank you, Corey. The next question, does Medi-Cal coverage include dental care or Denti-Cal?
And will children be able to find a dentist? Myra?
That's a great question. Those with full scope Medi-Cal also have access to dental coverage that gives children access to regular dental care and services, including everything from exams, x-rays, cleanings, fillings, and more. Most children will get their dental coverage through Denti-Cal and will use their Medi-Cal card to get the care. Children in Sacramento County specifically will receive their dental coverage through a dental managed care plan, and those in LA County will choose between Denti-Cal or a dental managed care plan. The concern around finding a provider, there are important resources to help families identify a dentist. To find a dentist that accepts Medi-Cal, they can call 1-800-322-6384, Monday through Friday, 8 to 5 p.m. Or they can look online at dentical.ca.gov and click on Find a Medi-Cal Dentist. If you want to learn more, there are a number of resources available to you, one being Children's Partnership.org/dental coverage. There are some flyers available for more information, and hopefully you'll get any additional questions answered.
Okay, great. The next question, will the Medi-Cal benefits be the same for the expansion kids, including mental health and family planning services? And if Lynn or Liz, you could answer this question. A secondary point to this, can you also explain what fee-for-service Medi-Cal is?
Hi, this is Liz. So the Medi-Cal benefits for kids will be the same as anybody with full scope, and especially for kids under 21 who have Medi-Cal full scope benefits. They have access to what Dorina mentioned earlier, which is EPSDT, Early Periodic Screening, Diagnosis, and Treatment, which is a more liberal definition of what is medically necessary. So any child with full scope Medi-Cal should be able to access what they need. I also wanted to circle back to the first question about pregnant women under 19 who are undocumented who will be transitioned. I just wanted to bring up the point that they are in a fee-for-service program right now, which means that they can go to any Medi-Cal accepting provider. So fee-for-service, they get a service, the provider is able to bill an itemized bill for each service provided. When these young ladies move over to full scope Medi-Cal, that's going to trigger the managed care packet to come to them. And so we want to make sure that they are able to stay with their provider, that they select the appropriate health plan that the provider is contracted with, as well as if they're not contracted with a Medi-Cal managed care plan, that they fill out the medical exemption request form that also comes with the choice packet that they will be receiving. So we want to ensure that they have continuity of care.
Thank you, Liz. Next question, what happens to a child when they turn 19 or will soon turn 19? Jen?
Hi. So this is a basic question that gets to what happens when you're not eligible for the program anymore. Medi-Cal has rules that when you're losing eligibility on one basis, they need to check to see if you have eligibility for Medi-Cal on any other basis. So they do need to look to see if you're eligible for any other Medi-Cal program. If the only immigration status that they have for the person is that the person is undocumented, that would probably mean that the person would be moved to restricted scope services. Now, they can't go ahead and terminate somebody without first going through their files to see if they have any newer information. So, for example, if somebody had reported that they had changed their status and had gotten a different immigration status, they would change them at that point to maintain them in the full scope aid code. And then even if the county doesn't know about it, they would need to send the person a notice. So when somebody receives a notice that says you're being terminated because you're turning 19 and you're no longer eligible for full scope Medi-Cal due to your immigration status, had their immigration status changed, they could respond to the county and give that information at that time. But like I said, for most people, it means that they will probably move into restricted scope Medi-Cal and only be able to access pregnancy, emergency, and certain other limited services. But as people's immigration statuses can and do change, that would be a good time to make sure that the county knows that somebody has a different status.
Great, thank you.
Next question. What will the transition look like for kids enrolled in My Health LA, and when will My Health LA disenroll children? Corey?
Hi. So My Health LA is LA County's program for undocumented immigrants, and they have about 10,000 children in My Health LA. They just released on Monday a provider information notice laying out their plan, which says that they are going to disenroll all of the My Health LA children starting June 1st, and starting on May 26th, they're not even going to take new applications for My Health LA, and that clinics and providers should be enrolling people in Medi-Cal. So this is a very swift and somewhat drastic approach, but so everybody in the Los Angeles area who works with My Health LA children populations should be educating those families and making sure that they do, in fact, get into restricted scope Medi-Cal if they aren't already, or apply soon for full scope Medi-Cal, because their My Health LA will end.
Okay, so we have a question requesting to clarify, what does public charge mean? Gabrielle, can you help us with that question?
Sure. Public charge is a term under immigration law, and it is one of the bases upon which a person could be considered inadmissible to come into the country. It means that the person is dependent on the government for their costs of daily living. It's assessed at 2 points in time. One is before the person enters the country, so we won't be seeing those people. The second is when somebody who is here is applying to adjust their status to become a lawful permanent resident. So people are concerned that if they're deemed a public charge, they're going to have trouble adjusting their status. And once they have become a lawful permanent resident, also called a green card holder, that assessment is not made again. It comes up in the context of public benefits like Medi-Cal because there are two kinds of public benefits that would be considered in the assessment of whether a person was a public charge. And this is in addition to all of the other factors that relate to whether or not that person will be able to support themselves and their dependents, including age, health status, education, prior work experience, assets, etc. So the two public benefits are cash assistance for income maintenance, so that would be general relief or CalWorks, and that's again for income maintenance, so it doesn't apply to short-term emergency cash or programs that assist with things like weatherization or electricity. The second and the only health benefit is institutionalization for long-term care at government expense, so that if a person were in a nursing home that was paid for by CalWorks, that could, depending on all of the other factors that are assessed, hurt that person's ability to adjust their status to become a lawful permanent resident. Just receiving regular ambulatory Medi-Cal for primary and preventative and even regular hospitalization care will not be considered for public charge.
Thank you, Gabrielle. The next question is, what role can schools or school districts play in enrolling eligible children? And Myra, if you could help us with that answer.
Sure, absolutely. I think all of us participating in this conversation understand the important role that schools play for our families, and in particular, the role they play in connecting families to health coverage. Schools really are uniquely positioned to serve as key partners to connect uninsured children and families to health coverage. Families trust the information they get from schools. They have a strong relationship with schools due to the connection to their children's lives, and as such, really are a unique vehicle of communication to reach families, and in particular, often hard to reach families. School leaders can send flyers home with students. They can place calls to families, send emails. They can bring an enrollment counselor to campus, or even host an enrollment event on their school grounds. Here at the Children's Partnership, we are proud to lead the All In for Health campaign, a statewide campaign to equip education leaders with the tools they need to connect families and individuals in the school, early learning, and after-school communities to health coverage and care. We work in close collaboration with folks right here that are part of this webinar, including the California Coverage and Health Initiative, as well as many of our education partners and Covered California, because we recognize the important role that schools play. We expect that through implementation of Health for All Kids, schools will be a critical partner, and we look forward to making that opportunity a reality as we move ahead. If folks have questions about the All In for Health campaign, please visit allinforhealth.org to learn more.
Thank you, Myra. So with this expanded access to coverage, a key question that folks have is, how can families find local doctors and providers who will accept their Medi-Cal insurance? And Corey will respond to that.
Before I respond to that question, I just want to clarify one point I made about My Health LA. My Health LA is not ending. They just are not going to give My Health LA benefits to children after June 1st. But once someone turns 19, they may become eligible for My Health LA again. So the program still continues. Now back to finding local doctors and providers who will accept Medi-Cal insurance. So as I mentioned earlier, in the month of transition or the month of approval of a new Medi-Cal application, children will be placed into fee-for-service, and so they can see any fee-for-service provider. There is a link on the second page of the frequently asked questions that are online as part of DHCS's eligibility enrollment plan, as well as the first beneficiary notice of action. And then once someone has chosen a plan, and again, a good way to choose a plan is to, if family members have a plan or a particular clinic or provider you're seeing takes a plan that you can enroll in. But once you're in a plan, even if you don't have those existing relationships, each plan has a member services department that is supposed to help you choose a plan. They can choose a provider. So they can look based on language and gender and distance from your home. So that is the responsibility of all Medi-Cal managed care plans. And I'm not sure if it's in the toolkit yet, but we will add it to the toolkit if it isn't, the link to the fee-for-service providers.
Thank you, Corey. We have about 10 minutes left, so we'll try and get a few more questions in, but please continue to submit your questions via the chat function. Whatever we don't get to or call on or answer today, we'll make sure to follow up with folks after this webinar. So the next question, how are kids enrolled in the California Children's Services, or CCS program, affected by the Health for All Kids expansion? Jen?
Okay, so many of the people who are in California Children's Services, and that's a program for children who have conditions that are disabling or they have certain chronic health needs. And it is open to people regardless of immigration status. So we may have many people who are eligible for SB 75 in that program. Now, the majority of them should be enrolled in restricted scope Medi-Cal because the program rules generally require people to apply for Medi-Cal, but in the event that they're not, they will need to apply for SB 75. So one thing to keep in mind and be aware of is if they were not in full scope Medi-Cal before, the California Children's Services was directly covering a lot of their medical costs. Now that they are enrolled in Medi-Cal and will likely be moving into a Medi-Cal managed care plan, there can be a little additional challenge in making sure that the services are appropriately covered, but they should still be able to use California Children's Services as the case manager of their services and as the entity that's approving which services they get. So they should still have that connection with the program, but who is actually paying for the services is going to be a little bit different. Typically when people do run into problems with coordination between California Children's Services and Medi-Cal, we generally refer people to our partners at Disability Rights California because they do have offices throughout the state and they do deal with these issues directly.
Thank you, Jen. The next question, what local outreach and enrollment resources are being made available to rural and isolated populations and communities? Mark?
That's a good question. I'm going to have to dial a friend right now. Maria from our office is sitting next to me, and she works with groups all over the state. So I'm going to defer to Maria to answer that.
Hi, everyone. So there's a lot of community-based organizations from churches to family resource centers, community health initiatives that are partnering with social services for many years now, enrolling individuals into health coverage. Our website at cchiforfamilies.org also has a link directory where we have combined the social services offices with the in-person by county across the state, where families can go and receive in-person assistance to apply for coverage.
Thank you both so much. So with that, I'll turn it back over to Myra to share with us some of the next steps and some of the follow-up after this webinar. Myra?
Great. Thank you, Fatima. And huge thanks to everyone for your participation on today's important webinar, especially to our organizers, our panelists, and our experts that answered a number of questions during today's discussion. We want to thank all of you that participated in today's webinar and want to remind you of a couple of important resources we talked about throughout today's presentation. Please visit healthforallkids.org to access the toolkit resources. We plan to regularly update those resources with the latest and greatest information, as well as important tools that many of the partners that took part in today's webinar will create as we move forward with implementation. As we've also mentioned, we do have a couple of follow-up opportunities to continue this important conversation. First, on May 6th at 1 p.m. Pacific, we will have a town hall that will specifically focus on additional question and answers regarding implementation. We hope to not only answer many of the questions that we may not have gotten to today, but also identify new questions and make sure that we have answers that allow all of us to be that much more informed as we work on this important policy. And then the second important event is on May 10th at 11. Please join our Twitter chat and take this conversation to social media so we can engage with community members that will be helping families and answer questions via Twitter. If you have any questions about today's presentation, any follow-up or additional areas that you'd like more information on, please contact us at questions@healthforallkids.org. If you have specific questions for the Department of Healthcare Services, their email address is on the screen. We thank you for your time today, and more importantly, thank you for your time and effort as we all work together to ensure the success of Health for All Kids. Thank you.